All right. Welcome back, everyone, for another episode of Innovators of Health. Here we are with Dr. Steve Derrington. And Dr. Derrington, thank you so much for being with us today. It's great
Yeah,
to have
pleasure to
you.
be here. Happy to always happy to chat about this.
So, why don't you introduce yourself to the audience? Who's Dr. Derrington?
Yes. So yeah, like you mentioned, Steve Derrington is my name. I grew up in the Midwest, small town, Nebraska originally, and then Wisconsin, Twin Cities area. Went to college at McAllister, played baseball and football there. And then after kind of the middle of undergrad, deciding I wanted to go to med school, um, did research for a couple of years while I was going through the interview process. And then school took me from Kansas City, Missouri to Detroit to South Florida to Philly to Napa. And then since then, I've stayed West Coast with my now wife and family.
Cool. And I, thing I know about you is that you're into CrossFit. You kind of keep up with a healthy lifestyle, huh?
Yeah, I mean, after playing, years of competitive sports growing up, once I, kind of finished that part of my life, needed something, and just going to the gym wasn't really very interesting to me. Easy to get bored, easy to lose motivation. So, kind of found that culture during residency, and there's just a great community of people, great way to get like-minded people together, a great way to stay motivated, and it's a good balance of competition, but it's cooperation and it's encouragement, and finding the balance, of course, as we get older, of doing the things in CrossFit that you do that are fun to do, but also making adjustments to how you're doing those things and the frequency you're doing them, so you can keep coming
Mhm.
back. So the things
Yeah.
that I talk to patients about every day, of kind of finding that balance of what kinds of things and how often you can do them. I'm slowly learning those same things myself.
Yeah, is that a good we had a lot of CrossFit patients. Are you gonna it's probably something that
I get some of those patients. Selfishly, I want to go to a gym where there's good coaching, of course, because as much as I know how to move and how to do things, you got to make sure that you're, staying on top of that. And when you're in the middle of a workout, when you're getting tired, it's not always easy to do that. So I probably could get a lot more business from going to CrossFit gyms. Coaches aren't as good. But, kind of on the flip side of that, when I do see those athletes, I know that they're going to get a good regimen as they're graduating from kind of the beginning stages, have and building back up and getting back into those movements. So I'm not going to see them again, 6 months later, because they're rotating uh, mad again, because their biomechanics or shoulder stabilization isn't as good as it should be, because they're not getting the right coaching. So I think overall it's a good thing. Although I could definitely be busier if I went to a local gym, just the same ways I could be busier if I was doing a bunch of steroid shots all day long instead of things that are actually getting better.
yeah, how did you get introduced to like on your journey um with kind of traditional orthopedics, and what was your branch point to regenerative medicine?
Yeah. It kind of goes back actually to medical school. I'm a DO, so different philosophy, different approach than what I knew growing up, as far as medicine goes. And some of the docs that I rotated with were doing prolotherapy. This is back in the early 2000s. Obviously, prolotherapy predates that for a long time. So I had a little bit of an introduction to that. I didn't know what else that could involve, but I got to see that being utilized. And then from med school in residency, physical medicine rehabilitation, which is really a specialty that's fairly newer. Can have an orthopedic focus, can have a neurologic focus, but the whole goal is to get people to be maximizing their function, getting them over injuries or adjusting what they have to do based on whatever chronic issues they have. So in that in that field, a lot of different ways to approach that or apply that when you're done, and whether that's you know non-operative sports medicine, working with orthopedic group, or doing interventional pain management, where most of those, at least traditionally, have been cortisone injections, prescription medications, ablations, and never really liked that. I wanted to be able to have some flexibility. I kind of had a thought in the back of my mind. There was something different, something better, probably from some of that initial prolotherapy experience. But I ended up doing fellowship with Marco Boder in Napa. One of my co-residents was a couple years ahead of me. She did the same fellowship, and as we were talking and she was going through it, I was like, "Holy cow, this is exactly what I want to do." So we were able to get a fellowship, which very fortunate, and had a great experience there, and that really kind of opened my eyes to what regenerative medicine could do, because it was kind of a hybrid practice where some of it was traditional insurance based steroid injections. We did a lot of EMGs also as a PM&R doc. We do radio frequency ablations. And I would see these patients coming back on my schedule every month or 2 months for more medications, every 3 or 4 months for another round of injections. But we also would have some of my schedule that was these patients that were getting orthobiologics, getting PRP. We were doing mostly bone marrow at that time. We didn't do any, we did, I think, one adipose case during that fellowship. But I would see those patients coming back with a family member or with a friend, or because of Napa, they'd be coming with like cases of wine, because a lot of these people are in the wine industry in some way. So instead of this patient that's continually frustrated and have a shot and I got this medication and I'm balancing the side effects of the medication, they were back out, doing things and coming back, with a very different outcome over a longer period of time than what I was seeing through kind of the more traditional ways. So once I saw that, I was like, I want to direct my practice if where I'm going to try to help people. I found that other pathway. Very invaluable, year of experience there, and it was really cool to see side by side how those, similar kind of problems with different applications of how to treat it, could change things down the road.
Oh, you're on mute.
Let's stop for just a second. Steve, your recording is like, the voice is really crackly. I don't know. It says here, voice, the audio is quality is going to be better than, what we're hearing. But is that, Jaydev, should we fix that? Because it's pretty consistent.
Yeah, let's, is the mic pretty close to you?
Mike's
Steve?
pretty close. I mean, it's arm's length away. Actually, closer than that. I'll move it a little bit closer and let me close some tabs. I don't know if that's messing with bandwidth.
Okay. It could be a bandwidth thing, but,
Yeah,
and that's
like,
what it sounds like, but, I think it'll be okay because, Riverside is recording on your end specifically, if there's any issues in internet and all that stuff, it does a really good job of capturing everything on your side and every one of ours individually. And then our producer can edit and make everything sound better. So that we can continue.
Okay. I closed a bunch of stuff, but yeah, if we're good, then we're good.
yeah, I don't hear it now.
Yeah, I don't hear it either. So I think we should be good. So, all right.
Steve, so let's go. We'll start back up. Is your practice still hybrid, or when? So that's amazing that you had that opportunity to kind of see, the compare and contrast of those different paradigms. How have things morphed now? Like, how's your?
So I was going ship, obviously you got to look at your next steps. And I was investigating a number of different, potential practice setups. At that time, this was 10 years ago now. A lot of clinics were open to the idea of bringing in regenerative medicine in some fashion, but that wasn't something that was established. It'd be like, oh, half a day a week, but you got to make sure you're doing the other stuff also. So as I was looking at several different options, that was really most of what was out there. And how much that would have actually been able to be achieved, or if it was just lip service of, oh, sure, we can do that stuff, but you're never going to be able to have the time to do it because consistent volume, which is how most of those practices run, you got to keep that wheel going. Otherwise, with insurances and margins, like you just don't have any extra, time there, and you're just running into the ground. You don't have time and effort to build that stuff because you got to keep your focus elsewhere. So I was very fortunate. Raul, I know you know Sean Patel very well. I had met him in the interview process for fellowship. And he was with a clinic that was basically 95% regenerative medicine. And he reached out to me towards the end of my fellowship and was like, hey, do you want to stay in California and do regen full time? I was like, yeah. So within a matter of, I think, 2 weeks, I met the owner of that company. I interviewed, and it was a pretty easy decision to join that practice. So I still do take insurance for consults. I do ultrasound evaluations that I build, but pretty much everything else from a intervention standpoint, whether it's injections, whether it's PBM, flexibility to treat patients how I think they should be treated, and they get to make decisions on their care instead of being dictated by somebody else.
Awesome. Love it. Yeah,
So
what
you
a nice
mentioned
opportunity.
so you mentioned PBM. So I was curious as to how you go about explaining PBM to patients.
Yeah, I try to. It's obviously sometimes hard to get out of your doctor brain and explain things simply because, especially the more we know, it just these complicated things seem very easy the more you kind of really understand them. But yeah, I try to make it as simple as possible. And as an osteopath, I know the body's innate ability to heal itself, but a number of things as we get older, nutrition wise, severity of an injury, just have a hard time doing that. But it's basically helping us to help reduce pain, reduce inflammation, and facilitate healing better than what we're able to do, on our own, or complementing the things that we're doing, to try to help injuries get better.
As you started to use it, one of our kind of mantras, what we've seen with PBM is, it's beautiful because everybody can use it. Maybe not everybody needs a PRP injection or a stem cell procedure, or even like the clinicians themselves, but this is something that all of us can use. How was your journey into using this, and you're using it yourself, and kind of
Yeah. So actually before having Red Vibe and getting into red light, near infrared light, I've got a class 4 laser in the office. And, that I see as kind of a laser focused, targeted for a particular injury by itself or in combination with some kind of injection, intervention, rehab, all that kind of stuff. Um, but as I got to be more knowledgeable about the spectrum of what PBM could be, I like the idea that this can be a tool that you can use to help facilitate things to get better. But also, there's an application that this is something that you use on a daily basis, and it's helping, a broader scope of things instead of just, hey, my rotator cuff is irritated now, or I've got a partial tear. I'm trying to facilitate that getting better with orthobiologics and some kind of PBM application. So actually, we give all our patients kind of some things to, some guidance on how to use it for their particular injury. But the back half of the 4 or 5 page sheet is, here's how you use it for bigger systemic things and mitochondrial support and helping with circadian rhythms and just overall kind of getting a nice system in line for a long-term plan for their health overall, not just reacting to when they have an injury and I need to direct this to that spot, which obviously it does also, but there's kind of a dual role I see for that. And that's where a lot of people get excited because one is something home, but it's also, you know, especially because I've been in practice long enough. I have a lot of, I treat the husband, I treat the wife, I treat maybe I can treat the grandma, and they can all have this at home and they can all be utilizing it. So they're not locked into, coming into the office, and it could be kind of maintaining things from an injury standpoint before they have to come back in and see me. But ideally, they're using this on a regular basis, as I've gotten to do myself, just for again, kind of a bigger plan to, try to take care of ourselves as we age as best as we can.
how have you found it yourself? Like, how are you leveraging it in your
Personally,
own,
yeah,
in your life, and your with CrossFit and all the stresses,
yeah,
work, family,
yes. So I
travel?
try to find time as much as I can, morning at night, to use it. We actually use it at night when our kids are in the bath and getting ready for bed. We have it on there to try to help them because they're two crazy boys and they hardly ever slow down. But kind of they it's kind of a little bit of a routine, but they obviously are getting some benefit from the light itself. I'm finding time at the end of the night to use it as I'm getting ready for bed as well. Um, and I'm just having that be a habit of what kind of what I do more often than not, once or twice a day. And as we're kind of talking about the dual nature, I'm actually a little, well, not quite a year after treating, but I had bilateral plantar fascia problems. I mean, Raul, you know the size of, I mean, my plantar fascia were like 0.66 and almost 0.8 thickness, all kinds of interstitial tears. Last, I think it was February or March, I treated with PRP once and then again, but I used photobiomodulation, and actually just this last weekend ultrasounded, and it was down to 0.38. I have almost zero symptoms, but as I'm playing old man football and running a bunch and not necessarily aggravating my feet, but I know that they're a little more, sensitive. There's no pain, but just kind of awareness. I'm sticking my feet up on the PVM on a regular basis, and I think it's contributing to me being able to stay healthy and having this injury that has been, almost completely healed. Stay at a really high functional level where I really don't really think about it anymore.
Yeah, that's how, I mean, for me, I have a 4-5 listhesis, facet arthritis. I've had my disc treated and things like that. And that consistency of use has been life changing with PBM. And it kind of is cumulative and building. But even then, like I have, a significant issue.
Mm-hmm.
And if I let it go, I will start feeling it. And
Yeah.
it's really interesting for, vacations or other times when, and plane travel isn't the best thing for it, if we're flying to Asia, and like I know you guys did.
Yeah.
And, those things will stir it up a little bit, but I can always come back to it. And it's a really nice tool to have. And, as you're starting to use this, uh, both the focus, when we were starting getting more and more in that, like the focus targeted
Mm-hmm.
regional. So like treating that kind of, the windlass, mechanism, and also abdominal or systemic therapy, like really getting a much more holistic approach, seeing that clinically make such a big difference. So it's really exciting that we're taking this medicine like from the MLS to now at home, and we're able to expand it
Yeah.
and really, broaden the scope of benefit.
Yeah.
It's awesome that you're using it.
I'm even seeing some of my patients who they got the laser um they got revived for what they had for a rotator cuff tear, and then she ended up breaking her foot, had an extensive bruising, and she emailed us like, "Can I use this for that?" I'm like, "Yeah, definitely." Like 2 days later, she's like, "The bruise is gone." Another lady who, venous stasis insufficiency, all kinds of chronic skin color changes on her legs, and she started using it on her shins, and she noticed an appreciable difference over the course of like a week or so of what that skin looked like. So there's nothing better than like seeing with your eyes. I mean, it's the internal things, the pain things that we're treating, and it's overall kind of systemic health. Those are harder to objectively see, but when you can visually see things changing, it's like I know that's doing something.
Yeah.
Yeah, talk about the torn rotator cuff. So when somebody came in for that, what were the results? How did you guide them through?
Yeah, so she actually had a pretty large, both shoulders, very large rotator cuff tears. They were retracted, and I told her, I was like, I can't, no matter what great treatments I have, I might be able to take some pain away, but I can't fix this. And I think she's young 50s. She's a pilot. Like she needs her shoulders to work. So we talked about coordinating with her surgeon, and they did surgical repair. We did bone marrow PRP combination. I think about 2 weeks after surgery, and then she had the Red Vibe that she took home, and she actually emailed me on I think either Christmas Eve or New Year's Eve, and she's like, amazing, I'm doing so great. You gave my life back. All these kind of things that are so awesome when patients reach out and tell us that. But she was using that as part of her comprehensive multi-step in a complex large injury that, as we know, these older patients, rotator cuff tears, they fail, unfortunately too much, and so when we can kind of layer on all these different things that can facilitate healing, she couldn't be happier with how her shoulders are doing, and now other things are responding to this tool that we gave her to utilize.
That's
Yeah, I
great.
think Jay, like,
Yeah.
is this self-serving? This question?
No, but the question is, there's a lot of people out there that are, you know, in the same position that, people like myself are, with the torn rotator cuff. And
Yeah.
so when they're hearing this, and they're thinking about what are my options, because if they go to, I've been to a surgeon before, and the surgeon told me what a surgeon is supposed to tell you, hey, I can't wait to cut you. So, but in, and then talking to Rahul, obviously, you know, he shaped my mindset around regenerative medicine for many years. But I was curious to just hear how, if somebody else is in these shoes,
Hmm.
how should they be thinking about their shoulders and their situation as it pertains to coming to you, and what they could what they could expect.
Yeah, well, I think you have to make sure you're getting enough information before you make any kind of medical decision. You go to one person, you're seeing things through their lens, and especially in a traditional model, it's kind of binary. It's like, does this need surgery or not? Or do we band-aid this for a while with steroids until we've damaged a tendon enough that it finishes tearing, and now you need surgery, but your tissue quality has been decreased along the way. Um, so I think having a conversation with somebody that is aware of things that are out there outside of just do nothing, do a shot, and do surgery,
Yeah.
that's going to empower the person to be able to make an informed decision for what makes the most sense, for them. Um, and as you guys know, there's all these different options that are out there, from orthobiologics, regenerative medicine, from an injection standpoint, from different energy modalities to stimulate. And depending on the presentation, it can be, you know, isolated components of this spectrum or combinations of this. But there's more that's out there than is commonly known with just the general population, and even a lot of the medical field, even specialty orthopedics, don't understand what's out there and what the data is. Where there's obviously a growing amount of data for a number of these things, but also just clinical experience that is maybe tracked in a registry or just anecdotal. But there's power in that, in those kind of results, and seeing how things can get better. And I feel like if you're not getting enough information and asking enough questions ahead of time, there can be buyer remorse afterwards. And I know a number of patients who had surgery on one area, and they come to me because like, I don't want to do that again. It didn't go as well, or just it was a longer recovery, and I want to see what other options I have out there. So asking questions and getting information, I think is almost always a good thing.
As you talk to your patients and are doing regenerative medicine therapies, uh, we're seeing a growing number of practices, and I believe you're in that direction. But you're creating a comprehensive plan. It's like,
Hmm.
okay, this you have this rotator cuff injury, and we want it, and all the indications or your diagnosis is appropriate uh, for regenerative medicine treatment, right? If you have a huge full thickness tear with retraction, you need surgery and then maybe augmentation with biologics. But hey, you're a good fit. Do you create a plan that includes PBM or any other modalities as far as like adjunctive holistic care? Is that kind of your approach, or how do
Yeah,
you?
I've been incorporating PBM for over a year now into the practice. Almost all of my orthobiologic recommendations. Now, on kind of earlier, less damage side of things, sometimes just good rehab, photobiomodulation support, and some time is all that you need. But when there's an appropriate orthobiologic application for it, I think it only benefits the patient to add on PBM to that. It just stacks the deck in your favor to get the most chance for benefit. And one of the things that opened my eyes the most was some of our colleagues that we all know, Rowan Paul, Aaron Demers. They've been tracking data, and they've been adding PBM into their practices. And when you see a divergence in outcomes with people that are doing orthobiologics at a very high level, that says something. It's not just, hey, I got a better kit and I'm actually delivering PRP versus something that's not that quality. Then that obviously shows you something, that there's really powerful in that, because you're controlling for the quality of the physician, the quality of the injectate, the quality of the procedure itself. And if you can make those improvements that much better and that much faster by delivering this extra therapeutic tool, why would you not do that? Because the
Yeah.
worst thing in the world, and we get so used to patients getting better a high percentage of the time, that you really get bummed out when someone doesn't do as well. But why not stack the deck, so when they come back in 2 or 3 or 4 months, you don't need to treat them again, because they've actually gotten better.
Yeah. there's a lot of focus, and being in regenerative medicine for 1.5 decades, it's interesting. There was so much focus, and I still think I talk to a lot of the younger docs, a lot of focus on like, what are you injecting? What's the actual technology? Those things. It's all the extrinsic
Hmm.
things, and sometimes less of a focus on uh, the intrinsic. Like, how do you, like, if you're working with a healthier patient, you're going to get a better outcome.
Yeah.
And I think this is one of those tools that you're actually affecting that intrinsic change.
Hmm.
Use it for, like, I don't know, are you starting folks, if they're like you mentioned that, if you have a really mild issue that you don't right now need an injection or more invasive therapy, that you can start with rehab, PBM, and you're stimulating that healing. When you do see somebody with, say, you know I've seen Jadev's rotator cuff, and if it's okay, let's put some autologous fat or BMAC or something in that defect, it's not retracted, and then stimulate. Have you found that, like, pre-stimulation or prehabilitation, has that been part of your, like, to start working on the systemic change or the tissue change?
That's probably one of the next steps of kind of optimizing our plan. I'm blessed that in San Diego area and Orange County, a lot of people already are, they're already eating well. They're already, optimizing with supplements and other things. They're in that mindset already. But some people, of course, still need, more help than others. Um, but I think that one of the next plans is to have that be an incorporated part of kind of prepping things prior to the actual biologic injection, um, because I think that can only help just to have a better starting point. Because as good as from time zero, injecting something, supplementing with photobiomodulation can be beneficial. Why not improve that starting point and go back a couple weeks and and it'd be interesting to see how that changes the outcomes. But starting from a healthier, less inflamed, better quality, substrate, that there's no reason why it wouldn't make things better.
And your treatments include PBM. Is that correct? Especially when you're treating them with certain things. Can you
Yeah,
talk a little
yeah.
bit
I
about
mean,
that? Like,
outside
what
of
are the treatments that you're?
combining those together, and obviously, I talked about having laser, prior to having Redvive, and that's a great tool, but it's in the office.
Right.
And I have patients that come. I've got two office locations that are 45 minutes apart, and I have patients that come from a much larger area than that, and you can't expect someone to come into the office 2-3 times a week, driving 2 hours each way every time. And that just doesn't logistically make sense. So having a tool they can have at home that is easier to prehab with, and then stay consistent actually utilizing it, because whatever great tools we have, it's only as good as it's being utilized. So if they have this there, that's sitting next to their couch every day, use it. And so I think that putting that together in something where they're having all the tools that they can utilize, so they can get as much improvement as possible.
Can you speak to some case studies and some outcomes that have really surprised you and stood out?
Yeah, I mean, I've had, so because of the CrossFit population, I do see some muscle injuries, quad and calf tears. So I think for those the way to apply orthobiologics is with platelet poor plasma versus the platelet rich plasma. But I've had a handful of those cases where sometimes even aspirating a hematoma from the injury, injecting with PPP, and then utilizing photobiomodulation to get them back to doing some pretty high level stuff. I've got a guy that they're CrossFit Games athletes that one of them had a calf tear, and this was maybe 2.5 months, maybe only 2 months before the games. And she was actually able to compete, where, she was having a hard time doing any kind of training leading up to that. She was injured, I think, in one of the earlier phases of competition to get to that point. Um, so that's one example. And I'm trying to think. Actually, there's one lady that, for some logistical reasons, she wasn't able to start her treatment. She actually, I don't know how she did this, but she tore a meniscus on one knee, and then while she was hobbling around, she tripped and fell and tore her ACL on the other knee. It took a month or 6 weeks before she could come in for her actual orthobiologic treatment. We pre-treated with PBM, and her inflammation, her pain levels were way down before she started, and she had a really nice, smooth recovery after the procedure. And then she eventually did great as she was healed from the actual intervention. But this is one of those episodes where pre-treating and getting things optimized ahead of time was really helpful for her.
Is that
Yeah,
part
that
of your process now, as the pre-treating and preconditioning? Is that something that you've now
If timing
incorporated?
works, we have some patients who are like, "Can I come in for my injection, today or tomorrow, or next week?" And sometimes logistically, it just kind of works that way. But if we can have them kind of pull the reins and say, "Hey, let's take a second, let's prep as best we can so we can give you the best outcome," that's part of the goal.
with your the community that you have you noticed anything or discussed, or even with yourself, and if not, I'd love to like have that discussion, is the like performance enhancement of using PBM, and especially on like recovery.
Hmm.
It's been pretty incredible. Over the past couple of years I've been uh, really kind of into the health, wellness, fitness space. Like it's helped me change my physique and body, and just the endurance and resilience, and the leveraging it around like working out or training
Hmm.
has been incredible. I don't know if you've noticed those benefits, but as far as like delayed onset muscle soreness and ability to get back in the gym,
Yeah.
and even so, I'm not like doing competitive performance, and maybe my metrics aren't so defined as say like in CrossFit, like where
Yeah.
you're really getting measured, or in high rocks or something like
High
that is
rocks.
another.
Yeah.
Yeah, my brother-in-law just competed in his first contest, and so he's a long time CrossFitter and kind of converted into the high
Yeah.
rocks. But when you have those measurables, have you been doing that, or have you talked to any clients or patients that have been
I
doing
haven't yet. I mean, I'm technically using it myself, yeah, partially for that reason. Um, but I think it's an interesting conversation to have with those high level athletes, where everyone's going to longevity clinics and everyone's looking into all kinds of other things. It's like, make sure that we're utilizing tools that have data, and then we can see some of the performance changes after applying them.
Yeah, because there's a really both pre-training or pre-competition. It could be helpful, but especially what I've seen is after a specific, like I like working out that specific day at that specific body part. If within, there's a few hour window that
Hmm.
if I get 5 minutes of PBM on that tissue,
Yeah.
it totally changes my recovery. It's incredible. I mean, I've tried it, especially quads, hamstrings for me, like leg days.
Yeah.
I do not like those days. They're rough. And a couple of days later, I get really bad delayed onset muscle soreness.
Yeah.
If I do this, it's 95% better. It's
Awesome.
pretty amazing. And if I miss it, it
You notice?
it's obvious. I mean, if there's something that you want to try, or with some of your athletes or patients, it's really interesting. So and now I just do that everywhere. So if I have a pull day, then my
Yeah.
back, like biceps forum, they're going to get the PBM, and it's just a lot better, almost to the point where I've had to slow down, like I'm overtraining because it feels good, and I'm
Yeah.
like, okay, I'm going to get back in because I'm not hurting, and I need to like kind of pace myself. So it's very very obvious for certain things, and that's one of the things that I noticed over the past couple of years, that if I miss, I know, because I'm going to be sore.
Yeah.
Raul, can you guys talk about the ex vivo procedure? Like, how do you guys, if you guys talked about that before, using, you know,
Yeah, so
PBM?
I'm not sure if Steve's using it, but ex vivo is just basically treating the kind of the tissue transplant or PRP or any biologic, orthobiologic substance before it goes into the patient with photobiomodulation, like in the lab setting.
Yeah. I haven't been doing that. I make sure that we apply PBM after treatment, basically right away. Um, but I guess I'm not activating prior to the actual injection. So um, I don't know if there's a benefit of doing both of those, but I know there's quite a bit of data on platelet activation, even honing local stem cells, and there's even some question of activating V cells or other different kinds of cells that are in our blood mixture, that have therapeutic benefits. So whatever we're activating in that solution, I think it's just giving you another better chance to to maximize the effect.
Yeah, it's the same. It's the same biology as the tissue, right? So if you're activating the let's take activating, because that there's different connotations of activation of platelets. So cell priming is a term that's been used, and so ex vivo is outside of the body. So treating these like in the lab setting. So when you create your PRP or your biologic product, before injecting at any point in time, you can illuminate or irradiate that tissue with photobiomodulation, and it will prime those cells just like you're doing. So anything that has a mitochondria, so maybe besides, exosomes, which you should probably be, depending on, where you live, you can't use anyway, but anything that has cellular material, platelets, or by illuminating it is short, like 60 to 90 seconds, there's a tremendous increase in that cellular activity. So there's a lot of studies that are out there on, anywhere from, ADSCs to platelets that show, a significant benefit of doing that in a lab setting. So that's something that we're, actively looking into and would like to do some, studies with our specific devices. But it's really interesting, and it's minimal kind of effect on your workflow, right? Because it's not that you don't have to, because you have none of the attenuation, right? So when you're illuminating tissue, you get, whether it's a laser or a LED or whatever your light source, there's a ton of attenuation, right, through the tissues. There's scatter, there's reflection, refraction. So here, when you have those cells in a clear test tube or a syringe, you're going to get a lot of um, photonic density into that tissue. So it's a very easy, uh, then there's minimal like harm. One of the considerations, kind of theoretical, is just heating of the cells. So you don't want to put it for a really long time, but 60 to 90 seconds. So it's really fascinating. You can and you can apply it both, on the patient. And then if you have this, you can put that on the product before you inject it as well.
Nice. Yeah, I know we talked about that before. Just need to remember to apply that and take that take that very short amount of time to do that.
Yeah. So we're actively, talking to some labs and scientists to get some bench research and studies, but there's a lot out there on these same specific wavelengths and energy levels for different applications. So it's the proof of concept is there.
Nice.
Yeah.
So what would you say to other practitioners, other doctors like yourself, who haven't started to incorporate PBM into their clinics, and really start to apply, this modalities the way you are doing, what would you say to them, especially the skeptics?
Yeah. Well, I mean, I guess, it kind of depends on where they're at in their kind of journey of hopefully transitioning away from traditional steroid band model into orthobiologics. But especially as we're, all getting further into it, getting a lot of experience, having all the conversations about, what their process, what their dose, all these kind of things with what we're injecting, take that conversation the next level and be, well, what else can we do? How else can we optimize? There's getting a growing conversation in a lot of our conferences about nutrition and supplement support on top of healthy, just eating. But that's just one aspect of it. I mean, there's several different areas where we can, take things that we know are beneficial in certain applications. We know there's data on certain things. How can that affect what else we're already delivering? So I think just being open to new things, kind of evolving as we're, learning more, I think is one of the biggest things. And um, obviously one of the mantras that I think we all heard in med school is, half of the stuff, if not more, that we learn when you're in med school is going to be outdated, wrong in some way in a, 10, 20 years. So it's like, why do we think that what we are comfortable with, what we've been doing for is the only answer? Look out for what else is out there, be objective and be critical about that. But, talk to your colleagues, do the research, go to the conferences and see what we're all clinically seeing, and understand, hey, why is that person's outcome better than what I'm getting from my patients, and what else, what are they doing differently? So I think you just have to just be have an open mind to what else is out there, just because you may not have heard about it before, or you maybe just say, this is what I do. Like, don't limit yourself, because that way you're only limiting what your patient's going to get too.
Yeah. And then that, and for patients and for anyone who listens to this, um, what should they know about you in your approach, and especially, for the kind of care they're going to receive.
Yeah, I mean, I think that, as we talked about from the beginning, kind of where my practice went from, kind of where things diverged from, traditional treatments to, concierge, or I mean, I was going to say concierge level orthobiologic application. That's kind of how I view my practice. I mean, patients are getting, they're getting ample amounts of time to, make sure I'm getting the diagnosis right, make sure I'm asking the right questions and understanding, so they're heard, they feel like they're heard for what their actual issues are, making sure they understand what their problem is, and make sure they
Mhm.
understand all the different ways that they could address it. I make sure that I still talk about traditional applications. They might consider surgery for a given problem. They might want a short-term band-aid with a steroid shot, but there's all these things that are out there where, most places they don't have enough time, and most of the patients that come into their office aren't interested in the other thing. So they're only given the normal option. They're told it's this or this. So it's like, well, what about everything else that may be out there? So one of the things that I really strive to offer in my practice, and I've got a new doc, and we're kind of echoing each other with that kind of approach, where we want to make sure that that people understand what their issue is and how do they get better, and all the different ways that they can get better. Because I think people need options, and they want to feel like they're empowered with their options and feel comfortable because they have enough information. So I try to make sure that we deliver that, and
Mhm.
do it in a caring and compassionate way, and an honest way. As we're talking about, it's probably malpractice to give somebody an orthobiologic option if they've got a full thickness retracted rotator cuff tear, or if they've got a spine problem where they're myelopathic. It's like, those need a different intervention than what I can offer. But if you have someone that is invested in the orthopedic space and knows enough about what can be treated and what can't be treated, that's the kind of person I think that you want to go to get clear answers and clear options.
That's great. I think maybe it was on your website or somewhere where it's like, um, you're addressing everything in between, uh, doing nothing or being cut open, right? That it's, but there's so many options in before I choose to do surgery if that's the avenue,
Yeah.
um, versus, okay, I don't want to do surgery. And also, if that's the case, then I'm not going to do anything about it. So I'm just going to live with the pain and live with
Right.
whatever I have. And what I'm hearing you say is there are so many things that being open minded would help a patient if they were just to come see you,
Mhm.
because there are so many different ways that you could uh, help them, especially help their body regenerate itself.
Yep.
That's awesome. Well, Raul, do you have any other questions? Because I want to give Steve the final word.
No, this was fantastic. Uh, I have to let a dog out. So he's gonna pee, and then we have a new baby Christmas puppy here, so he's looking at me. Oh no, no, too late. All right, now I have time. Um, no, I think we've really covered a lot. Yeah, I kind of Steve's and I, our philosophies are well aligned. Um, with what we're doing. So I'm glad that he's been really kind of jumped into the photobiomodulation, and it's awesome. It's such a great pairing with MLS too. Uh,
Mhm.
Excited that he's kind of been able to bundle this and get this to his patients.
And besides your website, where else can people follow you and get in touch with you?
Yeah, website, which is currently being renovated, which is a whole big project. But yeah, DarringtonOrtho.com is our website. But somewhat active on social media, SoCal Stem Cell Doc, um, on several different platforms. So I welcome people reaching out through the website, through the different social media platforms. And I think it's good to be able to just get some basic answers, or see if it makes sense to come in for consultation, or people that are far away. It's fortunate to be a really nice network of people that do what we do, that sometimes it's easier to direct somebody over there. So always welcome questions and communication from anybody that's interested in a different way to address their problems than what what is normally the normal approach.
That's great. Well, thank you again for your time. Thank you for being on our show. And yeah, this will be great.
Thanks for
And
having
then
me.